National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Jonathan Beatty, naturopathic doctor and a health expert here at nationalnutrition.ca. Today I want to talk about a very difficult to treat symptom, which is insomnia. And you'll notice I said symptom. It is a condition that people suffer from, but it's often a symptom of a variety of other conditions. And this is why it can become so difficult to treat, is there can be many causes contributing to your insomnia. Now, there's two main types of insomnia to focus on. One is what we call initiation insomnia, which is the inability to fall asleep in the first place. And then the second type I like to refer to as a maintenance insomnia, which is the ability to stay asleep once you fall asleep. I encounter different types of insomniacs in my practice. Some people have trouble with both falling and staying asleep. Other people, once they fall asleep, they can stay asleep. And then I have clients that can fall asleep no problem, but they wake up every hour after that. And the big thing is when you don't have that restful sleep, you're not giving your body that time it needs to recuperate. Sleep is that time for regeneration. It's the time when your body heals all the damage that's created through living your life through the day. And without adequate sleep, your body is not able to regenerate those tissues and you're just not able to function optimally. And so this is why it's so important that you get your insomnia under control. Now, with so many different causes, it is important that you work with your doctor to try and figure out the cause of your insomnia. Just taking sleeping pills is not necessarily the best solution, although I realize it is the solution most offered by doctors. Now, I'm not completely against it because, of course, if you're not sleeping, you can actually get much sicker, but they're there to manage the problem. They don't actually solve it. What you want to do is find a doctor who's willing to work with you on uncovering the cause of your insomnia. Now, that doesn't mean they can't prescribe you a sleeping pill or a sleep aid. What it means is they can't just stop at that. You'll want to work with them to uncover, is there a hormonal cause behind the insomnia? Many women, as they go through menopause, start to develop insomnia because of the hormonal changes they're going through. It could be related to blood sugar abnormalities. Sudden drops or rises in blood sugar can disrupt sleep and cause you to wake up. It can be an actual early sign of diabetes onsetting. So this is where insomnia can be used as a clue towards other health issues that are going on in your life. And if you get those under control, that can get rid of the insomnia. And so the other thing you want to look at too are nutrient deficiencies. Again, very often people are treated with medications for symptoms that are actually created by a nutrient deficiency. And unfortunately, the medication is not going to correct that nutritional deficiency. So it's never going to cure the problem. It's only ever going to manage it. And eventually the deficiency is going to become so severe that typically the medications are going to stop working. And so this is why it's so important to identify those deficiencies and correct them as early as possible to ensure that those are not the cause of your insomnia. So some things you'll want to look into, magnesium and iron deficiencies, I've both seen related to insomnia. And again, when those get corrected, people find that they're able to sleep more effectively. Chromium can be very helpful as it helps to manage blood sugar balance. And sometimes chromium deficiencies can impair your body's sensitivity to insulin, and this can result in maintenance insomnia. And then you can also have impairments in your body's ability to produce serotonin, which is required for sleep. And sometimes 5-HTP or 5-hydroxytryptophan can be very effective at managing insomnia. So these are some tools that you'll want to investigate. And then of course there's circadian rhythm. I always kind of explain it to my patients that your hormones are the orchestra and your circadian rhythm is the conductor. And so making sure your body is in a correct rhythm is going to allow all your hormones to work in harmony together so that your body can actually create restful sleep. And so it's really important to get your circadian rhythm on point. Now, if your circadian rhythm is disrupted because you either work shift work or you travel around the world and you're often getting jet lag and your body's trying to figure out exactly where you are in time and space, one of the simple things you can do to manage that is melatonin. Melatonin is a very safe supplement to take. It's best used sublingually or under the tongue because it's fastest absorbed that way. And what it helps to do is reset your circadian rhythm. And the only real major side effect you have to worry about with melatonin is vivid dreams. So that's why I like using it, because it's very safe to use. The only kind of side effect are vivid dreams, and there is research also showing that melatonin supplementation can actually reduce your risk of certain cancers. So the other nice sort of side effect of melatonin is cancer reduction, which is why I'm a big fan of it in my support of patients that suffer with insomnia. So if you do suffer from insomnia, I hope these tips will help you get a good night's sleep. If you like this video, please subscribe to our channel. Any questions or comments, post them below. And always remember, knowledge is health.